The Oregon Health Authority reported 323 new cases of COVID-19 across the state of Oregon. Significant numbers in Multnomah, Marion, and Umatilla counties contributed to today's case numbers. 2 people were reported to have died. The OHA also announced an outbreak at the Columbia Basin Onion facility in Umatilla County. It says a total of 22 cases were reported there. Meanwhile, a new study is providing some insight into how many Oregonians have been infected with COVID-19 without even knowing it. The study was conducted by the Oregon Health Authority, which looked for evidence of past infection in the blood samples collected from around the state from people who did not have COVID-19 at the time. It found that a substantial number of Oregonians have undiagnosed or unreported infections from the disease. Researchers collected 897 blood samples between May 11th and June 15th looking for antibodies. It found that 9 of those individuals, or roughly 1%, had been infected at some point in the past. The findings are 10 times higher than those reported through conventional testing, which was roughly what was expected. But if you extrapolate the numbers, they are significant. And while there is a considerable margin for error, it means that roughly 43,000 people in the state had been infected out of an estimated population of 4.3 million people.
I think the major takeaway from the results of the survey is that the vast majority of us in Oregon still remain uninfected and susceptible to the disease. You know, it means we've been doing a pretty good job at keeping the infection at bay. But the infections are widespread, and most of us remain susceptible.
And keep in mind that study was conducted June 15th was the last date, so the numbers are larger now, they think. The authors say there's a margin of error as well, given the small sample size. But again, if you extrapolate the percentages to a statewide population, millions of Oregonians could still be infected, and researchers are still not sure if antibodies to COVID-19 will protect people from getting infected again.